So, this is my maternal postpartum assessment. Unfortunately, I didn't have anybody in my family that was willing to be part of my video. Nobody wanted to be on camera. So I figured the things that I needed to be able to show on a person, how to do it on a person, I could kind of just do on myself. So we're going to give it a shot. So first thing you need to do when you walk into the room is, address who you are, what you're going to be doing if you haven't already. You need to be, clean, make sure your hands are clean, get your gloves on, the usual type of thing. So, first question you want to ask right off the bat is, are you in any pain, and what kind of pain, and what would you rate it on a scale of 1 to 10? And once you get that out of the way, you can do her vital signs. So it's really important that you're taking her blood pressure, you're getting her respiratory rate. Her apical impulse is definitely a must. You need to listen to that get it for at least 60 seconds. You also need to listen to her heart sounds and her lung sounds. So this is where this kind of comes into play. We get it on. So you're gonna want to be listening, to the heart. You're gonna want to be listening to the lungs, front and back. You need to listen to all lobes, every lobe of the lung. So after that, you can kind of just do like a head to toe type of assessment. So, you've done her vitals, so now you start with the breasts and her nipples. You're feeling for like hardness or swelling. You're looking for redness or like cracking of the skin or the nipples. You're really looking out for engorgement. And you're looking out for, like, is it heated? Does she have a temperature? Because mastitis is also an issue. You're also looking for, like, the quality of breast milk. Does she have a lot? Is she not have enough? Because what you're really looking for is if she has, like, a decreased amount. So after that, you are going to want to take her to the bathroom if you haven't already. And you're going to want to examine her urinary output. After you've done that, kind of get her back in bed, which, it's probably smart to do the bowel sounds before you palpate her fundus, because that could, you're kind of pushing around in there, that could affect it. So you're going to want to listen to her bowel sounds. She might not have much, if any, like right after birth, but, that's kind of normal, but she should after a certain amount of time. And then you're going to want to palpate her uterus. So you're going to start kind of with one hand at the belly button, and then back up a little bit here. So kind of like down here. And you're going to kind of push and feel around for her uterus. And it should kind of feel like a grapefruit. So it should be firm, it should be contracted. If it's boggy, that means that the uterus hasn't contracted and she's at risk for hemorrhaging. So after you've done that, you're going to want to check her lochia. So is it scant? Is it moderate? Is it heavy? What color is it? Is it the alba? Is it serosa? You're going to also want to notice the odor, because it should smell, kind of fleshy and earthy. The amount's really important. I think I already said that, but like, is she saturating it within like a 15-minute period of time or within an hour? Is the blood, is it bright red? Is it like constant? That type of thing. So it's important to check for that. So after you've done that, which at that time you can also, just kind of assess the perineum in general. What does it look like? Is there swelling? What is the coloring down there? You've already kind of assessed her pain levels. So now you're going to want to get her on her side. So you're going to be checking for the episiotomy and more around the perineum area for any extra lacerations or, tearing, that type of thing. And you're going to also be looking for edema, tenderness, hemorrhoids. Okay, so you're also going to want to be looking for hemorrhoids at this point. That's really important. And also for hematoma, which is kind of like that. It's going to look unsymmetrical. It's kind of purple or painful. So after you've done this, you're going to want to check for the Hohmann sign. So you're going to be looking at her legs at this point. The Hohmann sign, you know, you're going to be having her extend the knee and then holding it up and palpating the leg. You're kind of looking for like any clots or, varicose, varicities, that type of thing. So you're kind of feeling around for any tenderness. Is there hardness? Is there discoloration? Is she saying she's having any pain? So that type of thing. You're also going to want to be checking all of her pulse sites. So I don't know if I said that earlier, but especially at her legs, because she could have edema. That's another thing you're looking for, is if she has edema or swelling around the ankles. Checking her pedal pulses for sure. You can also check like her tibial or behind the knee as well. If you can't assess her pedal pulse, you're gonna have to use like a Doppler, just because like if she has edema, that type of thing, you might not be able to feel it, which edema as well, you should also be assessing, like if it's 1 or 2 or 3, that type of thing. So after you've done that, you need to assess her emotional status. So looking at her facial expressions, you know, what is her nonverbal type of movements and reactions? What are they telling you? You should also have her do like a self-scoring test if she has postpartum depression. That's something we're looking out for as well. And, you know, baby blues is normal, but make sure you know the difference. And in addition, you should also address her like nutrition, her fluid intake, you know, adjust it based on her status right now. Like if she's edemic, you're going to want to lower her fluid intake. You're assessing her sleep patterns, her activity levels, her CVA tenderness should also be assessed. So these are just some extra things. But yeah, at that point, you've kind of run through your full assessment. Ask her if she has any questions, and hopefully you didn't forget anything. So yeah.